As we continue our coverage of this terrible train accident in Hoboken, New Jersey this morning, and we await the latest information in a news conference scheduled to begin any second now. Let's talk with Dr. Ernest Patti. He's a senior attending physician of emergency medicine at St. Barnabas Medical Center in New York City. Dr. Patti, I would think by now you've seen the images of the car shredded by that concrete train platform, and I just wonder what your thoughts are on the fact that there is only one fatality and 3 people seriously to critically injured.
Well, obviously, we always want the least number of fatalities that we can have, John, but looking at the destruction and the damage to the train car and the ceiling above makes me very concerned about the types of injuries that we see in these types of disasters. Remember, myself and my team at St. Barnabas have been involved in more than these types of incidents that I care to remember. But usually you'll get crush injuries, a lot of orthopedic trauma. You'll also get head, spine, and torso injuries. And many times people can be trapped in the debris. And it needs to be secured properly so that the first responders can go in there safely and remove these injured patients. And
for you in the medical field, it has to be tough and stressful. I mean, you have to make snap decisions about who to treat first, and there can be brain injuries, for instance, aneurysms, that kind of thing that aren't visible to the naked eye. How do you prioritize?
Many times, John, we have a system. The triage system is extremely important in a multiple casualty incident like this, where we look at the vital signs of the patient, the level of consciousness, how if their airway is intact, and we have to make quick decisions on who gets the immediate treatment and whose care could be delayed until they can be brought either to a treatment area or to the actual hospital. Remember, depending on the number of casualties, sometimes we will treat a number of patients right at the scene. Others we will scoop and run and try to get them to the trauma centers, like my hospital or other hospitals in the area, Jersey City Medical Center, I guess, in this case.
The good news, I suppose, is that this being such a crowded metropolitan area, the hospitals are not that far away. The flip side of that is that roads are incredibly crowded that time of the morning, and it can take a while to get people to the hospital. So
that tends to always be a challenge for us, John. But the good thing is we really enjoy a wonderful 911 or 911 system in this country that we live in. And we get notification. All the local trauma centers will get a call. This happens routinely, and the doctors on duty will then notify the senior administration, and we'll mobilize all of our resources so that we have canceled non-essential surgeries and made available facilities and resources that normally we just have on hold for such disasters like this.
The impact of something like this, I mean, the physical impact, you talked about crush injuries and the like. From the sounds of things, the one fatality was somebody who was a woman who was apparently hit by flying debris, and there must have been a lot of that with the train coming in as fast as this one apparently was.
I'm sure in many cases, people get injured, maimed or killed by flying debris. It doesn't take much of a shot to your head to knock you out and render you unconscious, where maybe you fall and then you get hit with more debris from above. It's always a big consideration in these types of disasters, also with tornadoes, hurricanes, storms, building collapses, things like that. Many times it's the debris that kills the folks because they're too close to the actual explosion or damage.
And of course, in a hurry-up metropolitan area like New York, those trains are pulling into the platform, and I'm among them. I stand up many minutes ahead of time so that I can be one of the first one to charge out the door and get onto the platform and get on about my day. You had a lot of people standing, and that's, the seats aren't exactly padded, but standing up in a situation like that would be far worse.
Oh, sure, because think of it if you're in your automobile. We're strapped in and we have seatbelts. Now you're standing in a car, basically similar, if I can use the analogy, like a cattle car, and the car stops short and everybody who's standing gets thrown forward. People behind them pile on top of them, and then in the rush to escape, many times people sustain injuries to their torso, their head, their neck, their spine from the people who trample over them trying to escape, not intentionally wanting to hurt people. I mean, it's a recipe for disaster. It really is, John.
Dr. Ernest Patti, we appreciate your insights very much. Thank you.
Thanks for having me, John. I appreciate it.